question, what do you mean by palliative care, is a very important one. And sometimes there's some myths and misconceptions. So I'll start by saying that palliative care is really a special kind of health care for people who are living with life-limiting illnesses. It's an approach to care that recognizes that living with a life-threatening illness can result in physical, emotional, practical, and spiritual needs. And we need to think about all of those things in order to provide holistic care. Palliative care is commonly used in care for people living with diseases like cancer, or advanced heart failure, or respiratory diseases, or kidney diseases. We also talk about palliative care in relationship to advanced Alzheimer's disease, or AIDS, ALS, or multiple sclerosis. So you can imagine that palliative care actually is needed quite extensively within our healthcare system.
So Susan, as someone might be hearing more about palliative care or is seeking to learn a little bit more about it, how might someone access palliative care services?
So if a patient is wondering about the role that palliative care might play in their care, I would suggest the best starting point is to talk to the healthcare team already providing care. That could be a family doctor or nurse practitioner. It could be a specialist, an oncologist or a nephrologist or a cardiologist who might be involved in treating them for the disease that they're living with. It might be talking to the nurse that's involved in their care. If somebody's receiving care at home, talking to their home care coordinator would be another great place to start. And if they're in the hospital, they certainly could talk to a social worker like me, who could give them some information that's going to help them understand what the range of services are that are available. There is information for folks who are looking for general information about palliative care and specific diseases on many of the websites that exist, like the Canadian Cancer Society, the Alzheimer's Society, the Heart and Stroke Foundation. And there also, in most provinces in Canada, is a provincial or territorial palliative care association, which would serve as a place they could learn more about the services that are available in their own region.